Have you ever found yourself saying, hey, can you turn the TV up or turn the music up? Or I don't quite understand what you're saying. Could you repeat yourself? Or can you say that a little more slowly? That could be the sign of hearing loss, and sometimes untreated or undiagnosed, it might even be a significant progressive hearing loss. It could also be tinnitus or tinnitus. It's really fascinating when you realize and you understand and appreciate that hearing loss is a real thing and something that should not be disregarded or avoided, because if that is the case and you do disregard it, it actually taxes the brain. It can actually do damage. There's studies that say it even possibly leads to dementia. You don't want to have that happen. So, what we've done at Close-Up Television is we're going to dig in deep here with this episode. We've come here to Valparaiso, Indiana. This is the home of professional hearing management. It is headed up by Dr. Vasilike Rauch. She is a doctor of audiology. She is one of the people in this country, one of the few, that actually specializes in tinnitus or tinnitus treatment. It is exemplary what she does here. Her staff, the team she has around her, the patients love her as well. We're going to talk to some of the patients. We're going to talk to the staff. You're going to have an opportunity to hear the doctor's passionate words about why she wholeheartedly feels education is power, education is knowledge, and why it truly is important to get the hearing checked. You or maybe a loved one or friend who's experiencing it as well, they can help. We're going to go inside, we're going to check it all out, and it's going to be really a fascinating story. I'm Jim Masters, Close-Up Television and Radio, and here's the story.
Hi, Jim.
Hi, Doctor.
I'm so happy to see you. Thank you for coming today.
Pleasure to be here.
Welcome to Professional Hearing Management. Today I'm going to show you the office and introduce you to my great associates and some of my patients and let you see what happens here at Professional Hearing Management.
We did the radio show and it was so fantastic. I wanted to come here to Indiana to see you in person and to really experience what I keep hearing about, because you're so celebrated and so revered, and I think it's beautiful work that you're doing, Doctor. So we're excited to show it to our viewers on Close-Up Television.
Thank you, Jim. That means a lot to me. I'm so happy you're here.
So we'll go on a tour, right?
Absolutely. You ready?
You got it.
Well, Jim, I showed you where the patient sits and what happens there. This is where I sit. This is my equipment for the hearing testing, the speech clarity testing, and we have here equipment for otoacoustic emissions. That equipment tests the outer hair cells of the inner ear. Very important, because as we age, we lose our outer hair cells first, and even when we lose those, that in and of itself can cause tinnitus. So we monitor outer hair cell function, and very important when we test pediatrics, we test children. They can't always respond the way we want to, so we do other types of tests that don't need them to respond. We just test their inner ear hair cell function through that equipment. When sound pressure hits the eardrum, it starts to vibrate. That vibration starts the chain of hearing, and this is checking how the eardrum's vibrating, to check and see if there's any negative pressure behind the eardrum, if there's a perforation in the eardrum. We look for mobility of the middle ear bones. We do acoustic reflex testing, which is very important. It tells us things beyond the inner ear, more retrocochlear.
Okay, doctor. So we actually have a patient here that you're visiting with, and tell us about what he's here for.
Okay. Well, his name is Chris.
Good to meet
He
you, Chris.
came, yes, about 2 years ago to see me. He came because his wife wanted him to come. I hear this scenario a lot, to be honest with you. People struggle with, is my significant other having selective hearing, or are they not really hearing me? So I believe he came here just to make sure, he's hearing well. And
No, I came here to prove my wife wrong.
oh, that's what it is, yes.
What initially brought you to Dr. Rausch and professional hearing management?
Well, I retired about 10 years ago, and prior to that, for a number of years, going to meetings and being in crowds, I had difficult time listening to single conversations in a group of 3 or 4 people. And once I retired, then all of a sudden I was constantly saying to my wife, "What'd you say? What'd you say?" So finally I said, it's time to get this thing straightened out. I need to go look at getting hearing aids so that I could get this problem resolved, so that I'm not asking you all the time. Plus, I know I've lost some hearing. So I need to see a hearing audiologist to see what's going on.
How did you hear about this place and Dr. Rausch?
Okay, this Dr. Rausch was recommended to me by my internist. And I don't know how he knew her, but he said she was one of the best. And I said, well, that's what I want, one of the best. So I made an appointment and came in and see Dr. Rausch.
And what's the process been like, the relationship been like since?
It's been very good. I can hear my wife better now, and the TV, and other sounds that you lose, but you don't realize it until you get hearing aids. Then you start hearing sounds in a higher range that you weren't hearing before. So that was quite a unique thing. I remember when I first put them in, and Dr. Rausch crumpled a piece of paper, and I thought, holy mackerel, I never heard that much noise out of a piece of paper. So I was really pleased with just getting them in and hearing that part of it.
What initially brought you here to professional hearing management?
Back in 2014, my wife and I were transferred here from Pittsburgh. I had already been diagnosed with hearing loss in Pittsburgh and had my first set of hearing aids. So when we moved here, of course, I needed a hearing professional to look after my care going forward. And our office was not far from here, and it was just by chance that I located this facility.
When you were experiencing the hearing loss, what was that like for you? What were some scenarios where you asked people maybe to repeat themselves or speak up or speak more clearly? And was there any ringing or other sounds in your ears? Tell us about the experience and when you initially realized, I think I got to get this checked.
My initial experience was I did have ringing in my ears, which led me to the Balance Center at Allegheny General Hospital in Pittsburgh. Dr. Chen there heads up the Balance Center and spent a whole day with me. I mean, they put me through everything. And they found that I have benign proximal positional vertigo, which is typical with people with hearing loss. And that led me to my first set of hearing aids. Of course, like many people, I knew I needed them long before that. But I was like, no, I'm not ready for hearing aids. That's for older people, right? But my wife would constantly say, don't you hear me? Aren't you listening to me? Well, I could hear her, but I wasn't understanding what she said. So it was a big improvement in my life.
And what initially brought you to professional hearing management?
I had ringing in my ears and woke up one morning and the ringing was there. Wasn't sure what was causing the ringing, so I started doing research on what would cause ringing, and I learned a lot. I did a lot of research and basically learned that you needed to really have a doctor that understood tinnitus.
Did you know what it was beforehand?
I did not. One of the things I learned early on, because I did go see an ENT and I saw an audiologist, but neither one of them specialized in it. So I had to find somebody that had that background. And Dr. Rausch had that background. And what I loved most about her was her compassion and her empathy for my illness. And so she really helped me sort of cope with what I was experiencing.
What first brought you, Lisa, to professional hearing management?
I was looking for a different audiologist. The one that I was seeing prior, I didn't feel like that they met my needs. When I researched and I found Basilica Rausch, Dr. Rausch, I seen a lot of positive feedback, about her. So I thought, well, I'm gonna go and see, if she could help me. When I came, I got more than what I expected. She taught me a lot about my hearing loss and why. She explained a lot of things to me that other audiologists or ENTs never really did. I had no idea that, a lot of my hearing loss affects my brain. I didn't realize that both of those things played a big part with each other. And she was a big major influence, in me wanting to have better hearing and to have the proper hearing aids. And she's done wonders for me, and I couldn't appreciate her enough.
It's obvious that your patients really love you and they feel very cared for and they feel respected and, pun intended, they feel heard, because this isn't something that they probably share with everybody, because it is very emotional, very personal when it comes to not being able to hear in the efficient way that maybe years ago they used to. And talking with your staff, they're so dedicated to you and to one another. It really is a beautiful team. I'd like to go back a little bit. I like to, when we do our conversations and our interviews, I like to find out the backstory, what motivates people, what drives people, what inspires people to do what they do. For you, in doing my research and preparation for coming here to Indiana, one of the things I learned was a source of inspiration for you was a family member, a dear family member who was experiencing significant hearing issues. And it got to be quite traumatic and dramatic. Tell us that story and how that profoundly moved you in the direction early on in your life to want to pursue this avenue of endeavor.
Yes, thank you for remembering that. It's very important to me. My grandfather lived with us and he had severe hearing loss. And, growing up with him, I recognized the challenges that hearing loss presents to families. Of course, for the hearing impaired person, but also for the family members communicating. I noticed it generated a lot of tension, a lot of stress. Relationships, weren't strong. And growing up, I always felt bad for him that he couldn't hear, and for the family that couldn't communicate with him. And throughout, the years that I lived with my grandfather, he did get some hearing aids. He went to different places. And I remember even with the hearing aids, he couldn't understand what anybody was saying. Just by the laws of nature, when someone doesn't understand what we're saying, we want to talk louder and louder and louder. And I remember, yes, we are Greek and we are loud, and the family get-togethers are
Passionate.
Yes, that's a good word, Jim. Thank you, passionate. And when my grandfather couldn't hear, everyone spoke louder, and it like they were yelling at him. And I felt bad, and then he would leave or not participate. And throughout the years, as that was continuing, I noticed he wasn't socializing. He stopped going to church, which was a big part of, our family. He didn't communicate when we were there together. He'd leave. And that bothered me because even then I knew, social isolation cannot be good for him, right? And that whole experience made me realize it's very important to hear. It's very important for the person, It connects us to everything, our families, everything in our lives. Hearing just connects us to everything. And if we don't hear, it is very isolating. And that is exactly when I graduated high school, I thought, I just want to help people hear. And so here I am.
There really is an amazing story. So you have this dream, and then of course we can all have our dream, but then you have to make that dream and turn it into reality. Tell us about that process, you know, the education, building the expertise. How did you take that dream and turn that into a reality, Doctor?
Well, I actually went to University of Valparaiso for my bachelor's, and I obtained my master's at University of Tennessee. I started working after that. I worked at several different hospitals. And then in 2004, I decided to get my doctorate of audiology. I wanted to continue my education. There was so much more in terms of the discipline that audiology became. It's not only hearing devices, it's vestibular testing, electrophysiology, cochlear implants, oral rehabilitation, and tinnitus, which when I was in graduate school, we didn't even talk about it, right? And I wanted to go and expand my education, so I obtained my doctorate. My husband was in the military. We were, in the South, changing locations. Couldn't find a steady position. When we moved back, I was, blessed enough to work at the University of Chicago for a year. I got experience there with cochlear implants and a lot of pediatric experience. Pediatric electrophysiology was really my favorite part of audiology. And then I was very blessed to get a call from Ear Institute of Chicago to ask me to go to that facility, a very reputable neuro-otology practice. And I went there. I was there for 13 years. I became the director of audiology a few months after I got there. And it was just a life-changing experience. Every patient that we had was challenging. I learned a lot at that facility from the most brilliant neuro-otologists and the best audiologists ever. And we did, vestibular testing, cochlear implants, middle ear prosthesis, comprehensive evaluation. So I have a very strong background because I was there, and I learned a lot of, I had a lot of clinically difficult cases. And that is where my tinnitus, patients, I started seeing a lot of them. And so, when I decided to buy the practice here, I wanted to bring tinnitus expertise, of course, hearing expertise, to Northwest Indiana. I wanted patients that needed cochlear implants to not have to travel to Chicago, right? To be able to obtain the treatment here. And so here I am. I've been here since 2019, and it was a scary transition, right? Going from somewhere I was a director, I was also the secondary investigator of the Hinsdale Research Foundation. I did a lot of delegating, Jim. So that was I'm good at that. So I thought, after 13 years, I thought, I miss my patients. I miss just that journey with them. And I decided to go to private practice here to do that, to follow their journey and help them hear and live with less tinnitus.
In addition to creating the private practice here in Indiana, you've also participated in several clinical trials and research studies and have done multiple medical presentations along the way as well. Tell us about that.
Yes, I was in the clinical trials for a new treatment called neuromonics back in 2010, 2011, when all these tinnitus treatments started, coming up, right? We understand that tinnitus is a neurophysiological symptom, right? It is something that is created in the brain. And so then all these treatments started coming out. So I did participate in clinical trials of a couple of those different treatments and had really good success with both of the ones I did clinical trials with. Also, I used to work with Dr. Wyatt and Dr. Batista. They're very reputable neurotologists. So Dr. Wyatt and I did a lot of presentations on acoustic neuromas, cochlear implants, a superior canal dehiscence, a lot of different syndromes and pathologies of the ear. He spoke about the medical and surgical treatment, and I talked about the diagnosis of diagnosing these symptoms, these syndromes, and also treating them, the non-surgical treatment of them, cochlear implants, hearing devices, middle ear prosthesis, and just tinnitus treatments and things like that. So we did a lot of presentations together.
Now we're hearing a lot about tinnitus or tinnitus. I know some say one, some said the other. I've heard both. Tell us what it actually is and how debilitating can that be?
And they're both accurate, Jim. Tinnitus and tinnitus, it is a phantom sound that people hear. In the absence of external sound going to the ear, people hear a ringing, a chirping. It's not only ringing, people describe it different. A buzzing, roaring. It really just depends.
Constant tone.
Constant tone is a common one. And most often, it is a result of a hearing deficit. Okay? Whether it be cerumen, the sound can't get to the brain, a middle ear infection. Most of the time, it's permanent hearing loss from age, family history, noise exposure, ototoxic medications, health conditions that change the cells in the inner ear, prevent oxygen from getting into the inner ear. All those things cause these changes in the inner ear. And tinnitus is a symptom of that. When sound isn't allowed to get to the brain for processing, that is the brain's response, right? It is central gain. The brain is trying to recover what it's missing, and in essence fills in the void, and people hear tinnitus sound. How it is perceived by everybody is different, depending on the etiology of the hearing loss, depending on what part of their what frequencies they can hear. And the disturbance of tinnitus lies in the emotional response center. And so different people have different responses to it. Some people hear it and can disregard it. Some people get debilitated by it. So it's a vicious cycle, if you will. Lack of sound causes it. People hear it. They don't know what it is. When we hear something, we don't know what's causing it. It's scary. The emotional response center latches on. People focus on it. It gets louder and louder. Then people can't sleep because of it. And then how about the anxiety and stress of every day, Jim?
Lauren, tell us about your role here.
I'm the patient care coordinator and the receptionist. I answer the phone, make appointments, make sure everyone's taken care of.
And what is a typical day like?
Just making sure that the patients are taken care of from the moment they walk in, the moment I answer the phone. They're happy and pleased.
And what is your role here?
I'm the administrative assistant, so I manage correspondence, coordinate all of our office events. I coordinate the staff. I keep them on time, make sure they're getting things done on time. I run our meetings. I'm also the full-time bookkeeper. So I'm making sure that all of our AR is on track, that our patients are on time with their payments, and that our vendors and everyone is always kept happy on the back end. Kind of the stuff patients don't always see, but it keeps the business running.
Tell us about a typical day. What is it like here? It must get busy, and you're working with so many different patients who get such great value out of coming here.
It does get busy. Thankfully, we all work really well together. So you've met a few of the other girls. Patients will come in, check in, get taken to the back room. Sometimes a walk-in comes in. Hey, I'm hearing a little bit of feedback. I don't know what's going on. Christina, our lovely Christina, will come and clean their hearing aid. I'm back here, maybe an insurance company calls me. I have to file a claim, and then a patient is finished coming to check out. Okay, let's get you set up for your next appointment. And that's sort of just over and over again. So we all have our roles, but we all help each other to make sure, and really the reason we're doing it is to help our patients with their hearing journey. So that's, we're all supporting each other just to support the patient as soon as they come in and as soon as they leave.
Perfect. It's a pleasure.
You too. Thank you so much. Nice to meet you.
You as well.
Happy here.
Thank you. So you're dealing with a lot of different patients who are involved with hearing issues at many different levels. Let's talk about the process of when you're having treatments done. What is that like for the patient? What are some of the things that they're telling you that they are experiencing? And how are you and your team able to work with them to help them maybe achieve even some sort of a restoration of the hearing? Because it really is an intense process, isn't it?
People come to see me for hearing loss. A lot of them have tinnitus. Those two go hand in hand, right? So after we evaluate the entire ear, not just the beeps, right? That's important, but not the only thing. We evaluate clarity, processing, inner ear hair cell function, and then we come together and, we most of the time see where that auditory defect is. Most of the time there is a hearing deficit. Most of the time it's age-related changes, noise exposure, all those things change the activity in the inner ear and the brain, the synapses and the neural firing to the brain change, and the brain's response is that tinnitus. So most of the time we treat patients with hearing devices. If we have hearing loss and tinnitus, the obvious treatment option for both hearing and to reduce the tinnitus are hearing devices, the right ones. Advanced prescriptive technology, right? You can feed the sound into the brain where the brain's sensing the sound. Guess what happens? That brain will relax. That brain's that brain wanting to fill in the void doesn't have to do that anymore.
Right.
So for most patients, the tinnitus is mitigated, and for some they don't even hear it after treatment. We can't cure it.
Yeah.
Everybody has it. There's a lot of research out there that's looking to do that, but we're not there yet.
Does it get worse?
It can as the hearing loss gets worse, right? The less sound going to the brain, the more hearing loss. Typically, the louder and the tinnitus is. The disturbance of the tinnitus is very different. Some people have loud tinnitus, it doesn't bother them as much, and some people, the tinnitus isn't as loud and it's debilitating.
Can it fluctuate during the course of the day? Some days,
Yes.
some days it's louder or not, or some parts of the day it's louder and then softer?
Absolutely, it fluctuates. Some people it's constant. I'll tell you, I've seen hundreds, maybe thousands of tinnitus patients in my career, and I haven't had two that are the same, Jim. They are very unique.
Yeah.
Because the auditory defect, the hearing impairment, is only one part of it that's causing the ringing. How people respond to it different. People's anxiety and stress level. Typically, the more tired we are, the more anxious we are, the more stressed we are, that tinnitus disturbance gets louder and louder.
One of the things that is very near and dear to you is the importance of education. Education really is most important in terms of being a step in the actual treatment process. Just getting people to be aware of this and to understand and appreciate it, being educated about it, right?
Exactly. I do educate my patients. I always say an educated patient is the best one, right? They have to understand how an ear works, and then how their ear works, the difficulties they're having, why they're having them, and the mechanisms of tinnitus. And it's really important. When we understand what's causing a symptom, tinnitus is a symptom. It's not a disease or a syndrome. It is a symptom of hearing changes. When we understand what's causing a symptom, we're better able to cope with it.
Right.
Some patients, they come to me, mild tinnitus disturbance. It's a little annoying. I don't know why I have it. we educate them, and they come back, I don't need treatment. I understand what it is. I feel better. When we understand what's causing something, we're better able to cope. And so even with hearing loss, we have to understand not treating hearing loss causes a whole host of problems, right? Everybody wants to push it under the rug. Nobody wants to address it. It is very important. Untreated hearing loss, not good for the brain.
One of the other things too that I think is very important for people to know, doctor, is that in terms of the brain is getting exhausted. If all day long you're hearing either ringing or pulsations, or you're hearing a constant tone that almost sounds like a radio station frequency, or almost like the tones you hear in a hearing test, but it never shuts off, it's pulling resources from the brain that the brain would be using for other parts of your body, and can lead to memory loss and even dementia, right?
The connection between the ear and the brain is critical. We don't send the right sound to the brain. Number one, not only don't we hear well, we're not, communicating with our family. We're not hearing our grandkids. That's bad. But also, not stimulating the brain can accelerate memory loss, cognitive decline. People that have hearing loss are 5 times more likely to fall. So we educate patients on the importance of treating the hearing.
What about people that disregard it? Maybe they work in a factory and they hear machinery, and then maybe when they go home, they still hear the machinery in their ears, or they went to a fireworks display on 4th of July and they heard the fireworks popping off, and they're like, oh, well, that's just probably residual sound. Not always the case, right?
Just like with any medical diagnosis you have, catch it early, treat it early. And a lot of people don't with hearing loss. And there's different types of hearing loss, as we heard from some of our patients earlier. I have so many 10, 12, 14-year-olds in hearing treatment, right? And, when I was at University of Chicago, the babies, it's the number one birth defect, right? People forget that. All ages of life. People have middle ear disorders. People lose their hearing overnight, secondary to maybe a viral autoimmune disorder. It's everywhere.
The other thing too is you're hearing about other things in addition to tinnitus or tinnitus, lesser known, but growing in education and knowledge, is something called hyperacusis, and then something called misophonia. Hyperacusis, maybe an amplification of sounds in your ears, and then the misophonia, an aversion to certain sounds. Are all of these things related, and do these things sort of play off each other? Meaning if you have hearing loss and tinnitus, you're more apt to have hyperacusis and misophonia. How does that all work?
Hyperacusis is related to tinnitus, right? It's a central nervous system symptom. It is an intolerance to sounds that shouldn't be so loud. And typically the untreated hearing loss brain, people experience tinnitus and they experience hyperacusis. They do go hand in hand. And when we treat the hearing, we also treat the tinnitus and hyperacusis. In terms of misophonia, there is debate on whether that is a sound sensitivity or not. It is in terms of, certain sounds upset people, anger people. They have a hostile reaction to them. But the central mechanism of misophonia, they're not sure if it's the same as tinnitus and hyperacusis. It tends to be a kind of a gatekeeper reaction in the brain, whether a sound should be, someone likes a sound or hates a sound, happens in that emotional response center. And they're looking at, misophonia is a symptom of a lack of communication, or not sending the signal to the right.
To the right part of the
Does that
brain.
make sense?
Yeah, that's being misdirected.
Right.
Now, in the beginning, when you're working with a patient for the very first time, do you do an assessment, an evaluation? What are those first steps when you see that new patient?
You know, they fill out a form, a couple forms talking about when their symptoms started, but we go over, you know, some questions like a medical evaluation, talking about, you know, is there a family history of hearing loss? Right, it is very genetically driven, right? Noise exposure, medications that they might be on, all these things that can contribute or add to inner ear hearing loss. Health conditions, right? Diabetes, kidney disease, heart disease, all those things can accelerate the permanent hearing loss. And then you have hyperacusis. We talk about that and how bothersome is it. So we go through all these questions. I really learn, you know, most people that come to see me have hearing loss and tinnitus. So I try to understand what's the most bothersome, you know, to them, and how is it affecting their life, and what their goals are. You know, everybody's goal is to hear better, but what are personal goals? And then after we talk, of course, I do an otoscopic examination, make sure the ear is clear, you know, look at all that. If there's cerumen, we clean it out, and I do the hearing evaluation. Of course, the beeps, right? But I do extended high frequency testing, especially when my patients are complaining of tinnitus. And then we do middle ear testing, do otoacoustic emission testing, and I gather all the information, go back, and I explain it. I explain the ear, how it works. I explain how their ear works. I explain why they're having these symptoms, and then we talk about what we need to do to fix it. And that's when we start our treatment.
And you do what's called a prescription hearing treatment, which is the only FDA-approved solution for tinnitus relief, because there are sometimes other, you have a holistic approach, which is wonderful. There are sometimes other alternative kinds of things out there, and you pretty much warn against that, right?
I always tell my patients, you know, the only FDA-approved is hearing treatment. The Academy of Otolaryngology just said it is the only effective treatment for tinnitus, even for people with minimal hearing loss. Okay, that is very important. Patients will say, you know, acupuncture helps my tinnitus, and you know, I say, well, good, right? Anything that alleviates stress, Jim, anything that helps people not have as much anxiety will help with the disturbance of the tinnitus, right? Because if we sleep better, if we're less stressed and less anxious, we're not as bothered by the tinnitus. So I think if something's helping somebody, I say, well, great. If acupuncture is making your tinnitus less noticeable, that's fine. Mm-hmm. But it's more about the disturbance level. That one part we talked about, the emotional response. That's, you know, if we're less anxious, we're not as bothered by it.
You also took this one step further, and you've written several books, and there's even one for children as well. Congratulations on that, published author. What inspired you to write the books? And let's start with the first book.
Well, the first one is Hearing the Pathway to Countless Connections. And what inspired me to write this book is the hearing loss patient. Really, the person that just realized, I have hearing loss, or maybe I have hearing loss. There's really a lot of information out there, Jim. A lot of misinformation. And I feel bad. It's confusing. Where do I go? Who do I see? Well, I can go get this device. I can just order this hearing aid from the mail. Why didn't it help me? Most patients that treat their own hearing without even going for evaluation with something mailed in, or they don't necessarily perform well. They get frustrated.
Yeah.
They put their hearing aid in the drawer, and then they think hearing treatment is terrible. They never pursue it. Then they go 7 to 10 more years without treating their hearing loss, and then they have terrible clarity, and they gave them more chance of having cognitive decline. So it bothered me. People came in to talk to me. They have no idea about hearing loss. That's why I said, in order to educate the community and my own patients, this book was written really for my patients and my community, the community here, just to educate patients. So it talks about the importance of hearing. It connects you to everything, to each other, to your environments. And hearing connects right to the brain, right? It all happens here, Jim. Comprehension, listening, localizing, all that happens here. And it's very important for the ear to get the sound up to the brain so that those things, will be optimal. So I wrote this hearing loss patient, talks about when you have hearing loss. It's very important. This can happen if you don't treat it. This is where I advise patients to go and treat it. Talks about, hearing devices, cochlear implants, just a little bit so people can have a better understanding of that.
That's fantastic. And then you continued from there, and you have this second book too, Stop the Ringing. Tell us about that.
I called it The Truth About Tinnitus. Right?
Stop the Ringing.
Stop the ringing. And it is like a guide. If someone has ringing, we talk about the central mechanisms, what can be causing it. We talk about medical things that can cause it. We talk about different types of tinnitus. What we can do to help, direct treatments, indirect treatments, vitamins that can help. Just this whole guide to how we can help patients reduce tinnitus in their lives.
I love the fact that you are reaching out to kids early on, because these kinds of things, anything to do with medical with a child, can be very scary to them. So you wrote this beautiful children's book in a way that gets them to sort of understand it and to not be afraid if they are dealing with these issues, right?
I love children, and I always wanted to write a children's book. And James Dworkin and I decided to write one, and I'm very happy it finally came out. It is called Journey to the Inner Ear. It's about two little kids, Jasmine and Henry, who go visit their grandpa Tom. And they were talking to him. They said, can we go fly a kite? And Grandpa heard, let's go get a bite to eat. And then they realized he lost his hearing, so they go into his ear to help him find it. And I love it because it really kind of takes you through the ear.
Oh, that's cool, yeah.
Sections so little kids can learn about the ear. As these cute kids are looking for Grandpa's hearing, they go through the middle ear bones, through the inner ear, and it's, at the end they realize that, Grandpa just needed a hearing device, and now he heard him. It's darling. So I'm really happy about this book. And Jim, I'm also writing another children's book. I'm very excited about it. It should be coming out soon. It's called Eleni's Ears. It's about a little girl named Eleni. It starts off with her hearing well, and then she starts losing her hearing. And she starts noticing these things, and she visits an audiologist, and at the end of the book, she gets her hearing devices. It's for younger kids. This is maybe for 8 to 12. It's for younger kids, but it's talking about children with hearing loss. They can read it, and they can kind of understand the story and feel like they're not the only ones. And then it's going to be a series.
Oh, that's great.
The second book is going to be about Eleni with her hearing aids, her different life. And then the third book, her hearing is going to get worse. The hearing aids no longer help. She's going to get a cochlear implant. So it's a 3-part series. I'm really excited about it.
That's amazing. Congratulations on that, huh?
Yeah.
Published author. That's a beautiful thing. And, for different people, different levels, including reaching the kids, I think it's extraordinary. You know, you use cutting edge technology too. We've had a chance as we've been touring the facility. You gave us this beautiful tour. The latest in instrumentation, the latest technological advancements, and it continues to grow. And I think one of the things, in addition to the technological advancements for you, is the educational component. Being educated, having and absorbing the knowledge, it's instrumental in how you're going to then proceed. What would you say to somebody that is watching right now and they're getting what we're saying, they're being inspired by this conversation, yet they don't know what to do next? What do you hope, with us being here and spending this time with you today, our viewers are left with? What is your overall message? You've dedicated several decades of your life to this. This is something, doctor, that is in your DNA, in your heart and soul. You could be doing many other things, but this is something that is a lifelong journey for you, for the good of your patients. What would be the overall message for folks who are watching this right now?
To treat your hearing. If you're noticing hearing changes, tinnitus, if you're not enjoying your life or your communications with your family, if you find yourself isolated from conversation, take care of it. It's very important. There's a lot of help you can receive. And what I want people to understand is, with the appropriate treatment and evaluation and care, you will succeed. It makes me sad when people don't pursue treatment because their friend and their friend's friend didn't have a good experience. And so people then lead their lives with hearing loss, with debilitating tinnitus, when you don't have to, right? Why? There is help. You know, hearing loss happens for most people with age. But living with hearing loss and having a poor quality of life, that's your choice. There are things we can do. Not only hearing devices, with cochlear implants, we have oral rehabilitation. There are things we can do to help you hear optimally and improve the quality of life and help reduce the consequences of untreated hearing loss, memory loss, fall risk. It's take care of your hearing. It's very important. That's what I want everybody to know.
Thanks so much, doctor. This was absolutely an amazing visit. You've got an incredible team you're backed by. You've got wonderful patients who we had an opportunity to meet. And just speaking with you further, like I mentioned in the beginning, we did the radio show, but to fly out here to Indiana and spend this amount of time and learn more about something that affects millions and millions of people around the world, it's been quite a journey, and we appreciate all of the time and wish you nothing but continued blessings and success. Thanks for having us come, doctor.
Thank you, Jim. It's been great having you here. Thank you for listening to our story and for being here.
I am leaving here with a profound understanding, a deeper understanding of the importance of taking care of my hearing and how important it is for people that I care about to take care of theirs as well. It's important for you to do the same. This was such an incredible visit. And also, those books that we showed you on camera that Dr. Rauch has written, they're available at Amazon as well. So I advise you give them a call. For Close-Up Television and Radio in Valparaiso, Indiana, I'm Jim Masters, Close-Up Television.